the numbers are growing. Even Cristiano Ronaldo has got COVID-19. A lot of people have tested positive and then also recovered. We know that the numbers will now steadily keep growing till we peter out. So 71 lakhs overall is what India has crossed. But the very important data to look at, and which we've been highlighting on the show, something that the Health Ministry also said in its briefing today, is how many new COVID-19 cases are being added every day. How many new positive cases? So in the last 24 hours, we added about 55,000 new cases. That's a 2-month low, because from mid-August onwards, we had gone up steadily to almost 1 lakh new daily cases, and that was alarming. We have now been coming down steadily. It's a trend we spoke about on this show last week itself. But it's important to look at it coupled with a few other parameters. For example, what's the mortality rate? What is the recovery rate? And is this really now consistently enough to say that we are making a turn for the better? Is the worst of COVID-19 behind us? To speak on this, I'm joined now by Dr. Giridhara Babu, Head of Lifecourse Epidemiology at PHFI. Dhrubabrata, Ghosh, Dastidar, Director at Protiviti India is joining us on the show. Suvodeep, Rakshit, Vice President and Senior Economist in Kotak Institutional Equities is also on the show with us. We'll be speaking in just a bit with Dr. Arvinder Soin as well. Welcome to all of you. Dr. Babu, let me come straight to you and get your take on the numbers. I said in the beginning of my show that, people look at things depending on their outlook in life, glass half full or glass half empty. But I think data speaks for itself. What is this data telling you without the context surrounding it?
So the context is also very important. Thanks for having me on this show. This is definitely the early signs of what a good sign for the entire country is. Why the reason I say early is the winter is just beginning, and most people who are hiding away from the virus probably also start working with several relaxations in the unlockdown norms. While it is good news that the case positivity for each day is coming down, the total number of cases for each day is coming down, but those who have not been exposed to earlier are the ones who will be at highest risk. For example, you look at Kerala, what's happening. They have been susceptible for a very long time. The state did really well in terms of not allowing the local transmissions in many regions. But since the most population is susceptible, the moment local circulation establishes in such area, it is going to increase. Similarly, many other states are, as we speak, are surging. And if you look at mortality rate, nearly 53% of those who have died in India are above 60 years. So therefore, the elderly will be at increased risk as we move forward. While it is good news, we'll have to be careful and not let the guard down as we move forward till the good news is complete.
No doubt, there's no question of letting the guard down, but it's important to understand where we stand in this battle against the coronavirus pandemic, to also know how we can move forward. It's a signal for economic activity to restart, to open up, for people to feel more confident to do things carefully, of course, not brazenly without their mask. I for one believe if you're not wearing a mask outdoor when you should be fined, and definitely we should put that in place. But Dr. Soin, let me just look at the data, and we have spoken about this earlier. We're seeing a consistent drop. Is it enough to show a clear trend that we're beginning to push back coronavirus pandemic, or do we still have to wait and see how things work out?
So I think we definitely have to wait and see and be very cautious. It's obviously a welcome trend that the curve is declining. But there are several buts. One is that, is it just the first wave where the curve is coming down? Is the second wave still to come like the rest of the world? The second is, like Giridhara said, that populations that have not been exposed or have been so-called locked in are actually now getting out. So, for example, the schools and colleges open. Are we going to get a surge of infections like several countries have? if we make Diwali and wedding preparations and go ahead with plans like many people are we going to get a surge of infections? So we definitely have to be careful. And you're absolutely right. You have to mask and you have to socially distance. And I'll take up another little piece from what's already been said. We have to protect the vulnerable population. So who are the vulnerable people? There are people older than 60. There are people who are diabetics, who are obese, and who have heart disease, liver disease, kidney disease, and so on. So people who already have a health issue, a chronic health issue, or who are obese or old are to be protected. So I think if we look at those things and make sure that the vulnerable group is protected, the economy definitely needs to be opened out because we've already suffered a lot. And there is some cause for optimism for sure, because I tell you why. When the sero surveys were done across several cities, they found between 20 and 50% incidence of people having had infection. And if you count people who were falsely negative for antibody, perhaps 40 or 50% people have already had the infection. So you may not have such a big surge, but still the precautions must be taken.
You know, I want to ask about one specific point, and Dr. Giridhara Babu, I took up this issue on the show a few days ago, and one of my panelists said that look at how we're testing now. Initially, when we started testing for COVID-19, most of the tests were RT-PCR. Now, most of the tests are antigen, which have a high number of false negatives. And this could actually contribute towards lessening numbers. Do you think that there's any merit in that argument, and that's one factor to watch out for?
While I advocate for improved testing strategy, by improved I mean one has to find through syndromic approach. Those who have symptomatic are the main drivers, and then use both rapid antigen test and RT-PCR in the most judicious way. As you said rightly, RT-PCR is the right gold standard, and RAT has to be used. Rapid antigen test has to be used for point of care screening. And once it is positive, anyway, we don't have to worry. Only if it is negative and symptomatic, that's when RT-PCR had to be done. I think stronger review mechanisms of the states which are not doing this has to be done now. But I do not think that is the reason why the cases are going down. Even if that is a contributing factor, unless there is a real decrease in the transmission, unless there is a real decrease in the number of susceptible people, this is not going to show up. I mean, if RAT has a role to play, it has a role to play since its deployment, not just now. So therefore, that is a little noise that can be taken away. But I'm sure at least these are the early signs. I wouldn't say we should start celebrating the good news yet, but we have to be very careful even when we celebrate later on in terms of not crowding and avoiding 3 C's, crowds, closed spaces, and close contacts.
No, absolutely. I mean, we're caveating this entire show, almost every second sentence, by saying don't let your guard down. But I think just the fact that there is good news, and eminent people who track the numbers day in and day out say that, it's on a positive trajectory. We're hearing that after months. So let us savor this moment. Dhrubo, how do you see the numbers as, the government is reporting them? And especially, can you take us through a bit of the concentration of the cases now? More than 10% is coming from Maharashtra. Karnataka now has become the highest contributor to the new daily cases.
Right. No, you're right. And across India, we are seeing that the number of cases are decreasing. So, and as everybody in the panel is talking about, that we cannot let our guards down. And we have seen that with each festive occasion, there has been a surge. If you take the example of Kerala, I would be more concerned about places where it's going up, right? Places like Karnataka, Kerala, West Bengal to a certain extent, and even Rajasthan. So we are seeing a steady increase in the number of cases. And with the festive season around the corner, we should be a little bit more concerned about the places, mostly West Bengal for Durga Puja, and then after the north because of Diwali, right? Maharashtra, if you look at recently, it shows a decrease in the number of net new cases. So Maharashtra's trajectory is on the downward side, while the other four states, which I talked about, is showing an upward trajectory even now. So if I have to be concerned, I'll have to be concerned about these four states predominantly at this present time.
Dhruba, we also spoke last about the fear of COVID-19 spreading into rural parts of India and not having an adequate health infrastructure to deal with it. Are we seeing that that fear has not really played out so far?
I mean, if you compare urban versus rural, urban still continues to be the problem area, right? At least from the number of cases getting reported. Maybe predominantly because of the population density in the urban areas. Whereas if I compare the urban versus the rural number of cases and the peak, non-peak, I don't see a lot of these rural places contributing to these numbers. And in fact, all of these have started showing a downward trend. Yeah, Tamanna.
No, but my question, Dhruba, was could this be a function of higher testing in urban areas?
Yes, there is a part of testing which plays a role. So yes, urban areas are tested more, so the number of cases getting reported is high in the urban areas. And if you look at the number of tests being conducted, it still remains more or less the same over the last 1.5 months.
All of this is important. Why it's also very important to know that we are turning the corner and very carefully moving ahead with COVID-19 is because of the impact is happening. It will have on our economy and our economic recovery. Now, the RBI last week said that we will grow at about 9.5%. We will contract, beg your pardon, by 9.5% this fiscal. And that's their estimate. The IMF today has upped that figure to about 10.3% from their earlier estimate of minus 4.5%. The good news is that the rebound is expected to be more robust. Let's just listen in to what Geeta Gopinath has said on the India outlook before we move further with the conversation.
So in our projections, we are assuming that for 2020, it will be about $41 a barrel. And then in 2021, it goes up to $46 a barrel. But just remember, in 2019, these numbers were $61 and much higher relative to what it is now. So there's a substantial hit to oil prices relative to the pre-pandemic levels. So we do have a significant downgrade for India's growth for the fiscal year 2021. It's minus 10.3%. The hit to the economy has been large and pretty much broad-based, and you saw that in the April, May, June months. So this has been a very hard hit.
All right, I have with me also on the panel today Suvodeep Rakshit from Kotak Institutional Equities. He's an economist there. Mr. Rakshit, great to have you on the show and thank you for your patience. I wanted to play out what Geeta Gopinath said before I came to you to bring in context how you see these GDP forecasts with the possibility of an improvement in our handling of COVID-19. I mean, it's all inextricably linked. Do you think that there is a case coming up ahead for a GDP forecast revision, as some have suggested, including in Credit Suisse?
Yeah, you correctly pointed out the fact that this first and foremost was a health crisis, still continues to be a health crisis, and till you solve the health crisis, it will have an impact on the economy and a lasting impact on that note. I think one way to look at it is that, look, we have seen the trough, right? We have seen a 24% decline in GDP in the first quarter. And from there on, it is pretty much obvious that there will be improvement. Now, the improvement can be broken up into different parts. And in that context, you can debate whether it's a minus 10% or whether it's a minus 9% or whether it is, there will be an upgrade and whether it is a minus 5 or, even better. But the point essentially is that if you see the recovery, at a very broad level, it's a two-paced recovery. It's a pretty much uneven recovery that we are going to see, not just in FY21, but possibly into FY22. At a very broad base, you're seeing two-paced recovery, one where the manufacturing sector or the industrial sector is growing faster, and two, where the services sector, obviously, which is dominated with much more of contact-based services, is seeing a much slower recovery. But as the opening up is happening, there will be some catch-up that the services sector will be undergoing. At a little more granular level, it's actually three paces of recovery that you can think about. One, where there were essential goods and services, which continues at a pace even which, or maybe at a pace higher than what it was in the pre-COVID period. Then comes, goods and services which opened up through the unlock 1, 2, 3, 4, and so on. And that is basically what we are seeing right now, something that you're seeing in terms of the auto sector, in terms of real estate. So these kind of recovery you're obviously seeing. And third is where, ultimately the services, which is like the restaurants, the hotels, the transport, etc., open up. And that is the last leg of recovery. But all of these underlying point is that there has been a demand destruction that has happened. There has been a supply disruption that has happened. There are job losses and there are income losses, which will take time to normalize. It's not so easy, for example, for a salaried employee who has lost job or who has lost his income to get back a new job or suddenly get a 10-15% increment, so that the expenditure in the economy starts to, you can say that, pre-COVID levels have been reached across the board.
Yeah, no, absolutely. I mean, it brings to light the attempt by the finance ministry to push some kind of a consumption through government employees and this, voucher scheme and this festival sale advance scheme. But definitely it'll be pushed. It'll be difficult. Suvodeep, I just want to focus a little bit more on the context of what we're seeing today and the improvement in COVID data. Do you think in terms of a sentiment booster, it will have a bigger impact? It will have an outsized impact? Because remember, sentiment is driving a lot of the gloom around the pandemic as well. If you look at actually the number of cases per population or the number of deaths as a percentage of the population, many have pointed out about how it is very, very little compared to a lot of other diseases that abound in India. But it has been the fear factor that has paralyzed this economy and the world actually for the last several months. What will be the economic impact of that fear factor receding?
See, I think from a consumer behavior perspective or a consumer psyche perspective, I think the fear factor, if we see the recent, kind of trends, the fear factor has reduced considerably. And I think that is also linked to the fact that the fatality rate has been low. If we had fatality rate in, the kinds we have seen in the Western world, I think the caution would have been a bit more. We still do find anecdotal evidence where some amount of caution is thrown to the wind, which at the end of the day, when you try and translate it into your economic sentiment, etc., it at a very simple level would mean that probably people are more open to going to a restaurant and eating, or maybe going to a shop and buying goods. Maybe the festive season is coming up and people will be enthused to go out and shop. The risk comes in that, see, all this is good. I mean, people going out buying, etc. But as I said, that since it's a health crisis, the risk comes in if during the festive season or post the festive season, if the numbers significantly go up. And when I say numbers, it's not just a testing process, which obviously the doctors and the experts would know better, but not just in terms of the testing process, but also in terms of in your community, what kind of spread are you seeing? The psyche changes when somebody in your family has COVID, or somebody around you in your apartment or in your society has. There are a number of cases increasing. Until till the time there is no risk to these kind of spreads or kind of anecdotal evidence that consumers can see, we can see that the consumer sentiment will be coming back. Now, the sentiment has to be backed by income. There has to be a source of income which is steady, and that drives the recovery.
Absolutely. Absolutely. Sentiment has to be backed by income. I think that's a real quotable quote from this discussion. But let's focus a little bit on sentiment and the numbers. Dr. Babu, do you think that there is enough in place policy-wise to ensure that we don't have a resurgence? Everyone keeps saying today, even at the health ministry briefing, there was this message that let's not, get ahead of ourselves. Cold weather is coming in, festive season is coming in. But anyone who goes out and you see the way people are behaving, in a lot of places it's as if COVID never happened. Do you think there needs to be now more stringency in ensuring that this recovery is not derailed by careless behavior?
Yeah, so while cautious optimism is the way forward, it's all about sentiments, as the previous panelist rightly pointed out. In order to do that, we need to understand this virus has surprised everybody, including the President of the United States. So therefore, what we need to do right now is to be responsible. Mostly, as earlier we have discussed, we need to be careful in respecting and protecting our elderly, both within our households and around us, then those who have comorbidities. So this will happen only when I take the responsibility, the society takes the responsibility, and the young people take the responsibility. It's easier said than done. But in order to promote this, the government of India has already started with a new communication campaign. But that's not enough. People should participate. More than stringent actions, I feel community partnerships and people coming together in understanding that we have been okay. Many people give doomsday predictions in India, but then we have done reasonably well. We can continue this as long as we are responsible. So that should be the way forward.
Absolutely. It's like I said, after a long time, it seems like things are looking up. Let's not mess this up with careless behavior. Thank you so much to all of you for joining us on the first discussion this evening on the show. And here's to hoping that improvement in COVID numbers prevails in a steady fashion.